Hello everybody, it's Dua Al-Qaisi. In this presentation, I'm gonna discuss a case report for a 6-year-old patient who presented to the clinic with his mother. They came for evaluation for painful and bleeding gingiva in the kid's mouth. Those gingival changes started 7 months ago, and the mother reported that the onset wasn't associated with any kind of trauma, whether it's chemical, mechanical, or thermal trauma. Upon taking a medical history from the mother and her kids, the patient was found as an asthmatic patient. He takes mometazone inhaler to prevent the difficulty of breathing that is associated with the asthmatic attack. He also went to his pediatrician 2 weeks ago to check if he has any underlying breathing disorder. His pediatrician did CBC and checked the metabolism panel in him, but he found that he's healthy without abnormalities. 1 week ago, he went to a dentist and did some prophylaxis treatment, scaling and polishing for the teeth, but no improvement was noticed. Upon intraoral examination, uh, the dentist noticed some mucosal erythema at the right and left side here. At the right side, it was less defined, but in the left side, it was more defined. Uh, he also noticed interdental papillary swelling here, an ulceration here, and some linear ulceration in the alveolar mucosa, this red line. He noticed lip swelling and angular cheilitis at his lip or extraorally. This lip swelling led the dentist think about an underlying systemic disease, so the dentist took a biopsy from the swollen gingiva and sent it to the histopathology lab. The histopathologic image showed non-cassating granuloma. So the dentist decided to refer the patient to his pediatrician to do further investigations and rule out any granulomatous inflammation. Also, he prescribed a mild steroid rinse to the patient and advised him to spit and rinse 4 times daily for 2 weeks under his mother's supervision. In the follow-up appointment, the gingiva showed improvement, and the mother told him that the kid is now has less pain and bleeding during brushing. Then the patient went to his pediatrician. He referred him to his gastroenterologist for consultation. He went through endoscopic examination. Biopsy was taken from the intestinal mucosa, and it showed acute inflammation. Unfortunately, the patient was diagnosed with the Crohn's disease. And here our role as dentists comes to notice any changes in the oral cavity, as it may show an early diagnosis of underlying systemic disease, so we can help the patient to avoid so many complications. Thank you for listening.